Hello, my name is Sean Kennedy. I'm the Director of Health Information Exchange for the Massachusetts eHealth Institute, and today I'd like to share with you the apples and oranges of HIE. Allow me to start by briefly working to detangle a sampling of the myriad of organizations in this HIE space. We're in a dynamic market with organizations taking shape to address the variety of opportunities HIE presents, like building trust, ensuring conformance to standards, establishing information pathways. While I slotted organizations and efforts into categories, few fit so neatly into one category. Starting with collaborations, these organizations grew out of a need to more easily exchange information. If you've not lived with this yet, you will. It takes at least two to dance in the world of HIE, a sender and a receiver. So it is natural that groupings of organizations would rise to tackle the numerous barriers that exist or to take advantage of the emerging market. The Care Connectivities Consortium is a collaboration among provider organizations, Geisinger Health System, Group Health Cooperative, Intermountain Healthcare, Kaiser Permanente, Mayo Clinic, and Oregon Health Information Network, in collaboration with HealthyWay to develop and incubate new capabilities for consideration and adoption by eHealth exchange participants and the broader HIE community. They provide patient matching, record locator service, consent management, and integration services. Where the Care Connectivity Consortium is comprised primarily of provider organizations, Commonwealth is comprised primarily of EHR vendors, such as Allscripts, Athena Health, Cerner, CPSI, Greenway, McKesson, and Sunquist, and aim to tackle the problem of interoperability of EHRs. They provide patient linking and matching, patient access and consent management, record locator services, and directed query services. Care Equality, while a collaboration, does not offer a set of technical HIE services. Rather, they are an action-oriented collaborative that aims to build upon existing exchange capabilities, leveraging existing standards and agreeing upon innovative approaches to improve exchange workflows and adoption. Similar to how banks came together to grow the adoption of ATM networks, they aspire to do the same for HIE and healthcare. Moving to the trust quadrant, Direct Trust maintains a national security and trust framework to support of direct exchange and is made up of over 120 representatives covering HISPs, HIEs, certificate authorities, consultants, state agencies, EHR vendors, and provider organizations. They offer a trust bundle service, essentially a way to scale trusted exchange for accredited organizations. In a related manner, the National Association for Trusted Exchange, or NATE, developed a scalable trust and policy framework that is intended to eliminate the existing barriers inhibiting the use of health information exchange. Different than Direct Trust, their membership is primarily, but not exclusively, made up of states: Alaska, California, Florida, Hawaii, Missouri, Nevada, North Dakota, Utah, Oregon, to name a few of them. They also provide a trust bundle, among other services, to facilitate trusted exchange. Scooting down to the HIE box, HealthyWay is a nonprofit spun out of ONC to manage the eHealth exchange, a trusted, secure, nationwide HIE with shared governance and necessary shared services for organizations who wish to connect to a network of networks. They have thousands of providers connected and provide a gateway for exchange with participating federal government agencies. Similarly, the Mass Highways are HIE on the state level. This is a public exchange funded primarily out of federal funding, but also through state matches, and then also through contributions through membership fees. eLink and Wellport HIE are private regional exchanges that exist here in Massachusetts, and collectively eLink and Wellport can connect into the Mass Highway, and then ultimately all of them could connect into eHealth exchange to really become a network of networks supporting cross-nation exchange of information. In wrapping up on the certification and accreditation category, these two bodies work to promote consistency in the market by certifying or accrediting issuers of digital certificates. Federal Bridges is the federal government's common infrastructure to administer digital certificates and public keys, including the ability to issue, maintain, and revoke public key certificates. The term Federal Bridges Cross-Certified implies a HISP conforms to the Federal Bridges Certification Authority requirements. The Electronic Healthcare Network Accreditation Commission aims to achieve quality and trust in health information exchange by accrediting HISPs, CAs, RAs, and HIEs through the various accreditation programs like HIEAP and DTAP for HISPs. This is a dynamic and remarkably confusing environment. The key takeaway is that all work together to enable trusted, secure, scalable